All right, this is Joe Johnson of Cancer Dudes Live More, and today I have another guest with me, Dr. Nasha Winters, who is an expert in integrative oncology, and she practices in Durango, Colorado. She's a naturopathic doctor. So welcome, Nasha. Thank you for joining me today.
Thanks, Joe. This is a treat. Thank you.
And
getting me on Skype for the first time.
I know, she's on Skype for the first time ever. So this is the world premiere of Dr. Winters on Skype. I guess first off, can you tell me just a little bit about what you do and kind of the work that you do with people with cancer?
Yeah, great. Well, when I got into medicine, I, of course, like most people who get into healthcare, we all have our own, wounds we're trying to heal.
Mm-hmm.
And so I had my own issues around health and actually a cancering process. So I was pretty inspired to learn more, just to help my own body, my own experience. And I swore when I started medical school that I would not touch cancer with a 10-foot pole. I wanted it so out of my energy field, if you will. I just was kind of over it. I was done with it by the time I started school. And I really spent the next, several years really avoiding it, I guess you could say. But once I left medical school, my very first patient on my very first day in private practice was a gentleman with an end-of-life stage of glioblastoma multiforme, the most aggressive form of brain cancer there is. And I just thought the universe was playing some pretty interesting jokes on me. But because I just loved this man and his young family and his wife, I thought, well, I can offer some acupuncture support and maybe some background of homeopathics for pain management. And I really thought I was looking at the last days, if not weeks of his life. And he surprised us all by going another 6 or 8 months, even with completely shut down ventricles and his brain, completely blowing away the radiologists or the pathology folks and the folks reading his scans. They were just like, this is impossible. And so he inspired me into the miracle, that there's so much we don't know, and really inspired me to just not shy away from this and go deeper. And over the next, that was in 2000. So here it is, almost 2014. 14 years later, slowly over time, my practice has built and built and built more and more of a patient population that needs some support around cancer. And to the point where last December, I shut my practice down, a very huge practice to a very general practice, down to oncology, even though I've been studying oncology very thoughtfully for the past 10 years. Finally realized that it was a full-time job in itself. And in clarifying for you and your listening, watching audience, I don't treat cancer. I treat people who have to have that process happening in their body, and offer whatever support and guidance I can in that moment. And oftentimes we see a complete resolution of that process. Sometimes we go into a maintenance of that process, that maybe they will live well with cancer on board for, unlimited amounts of time. And sometimes I am with these folks through their process of letting go entirely as they take their last breath. And all of it is amazing and rewarding and educating and life-changing every step of the way.
Totally. Yeah, that's awesome. It's very inspiring.
Yeah.
And now, so do you, you said the term cancering process. Do you prefer that terminology versus like having cancer or something like that?
Yeah, thank you. That's a great question. I choose those words carefully because I think in our culture and the way medicine sort of gives us the information in our media and our conventional medical system, and even non-conventional, my other colleagues who practice very out-of-the-box medicine, they really treat cancer more like a noun, but it's a very dynamic process. And the very fact that we can literally poke a hole into something to do a biopsy and change the absolute expression and manifestation of that cancer in that very moment. So we might have started off with an ER-positive breast tumor, poke a hole in it, and now it's an ER-negative breast tumor and maybe HER2 positive. that in an instant we changed its personality, if you will. That in and of itself, having lots of research to show that happens, shows what a dynamic, ever-changing process this is. Yeah. And so I think it was David Agus or Agus, I can't remember his last name off the top of my head, but he had coined the word cancering. And I really love that because it felt like so encompassing of how I see the cancer process.
Right.
It's a squirrely little guy. It's changing, with whatever information we're giving it, from our thoughts to our to our treatments, both conventionally and non-conventionally. We are changing those cells on a very rapid fire basis.
Yeah, just moment to moment. And that's really empowering, too, because you can change it for the better then. And in every moment, you can be changing it for the better.
That's exactly right. And I think people need to be aware of that it is, it's a transformational experience. And I don't know if you've seen is it Mina Bissell, her TED Talk on the extracellular matrix, and talking about the dynamic process of cancer cells. And she's like a famous cancer researcher who's been at it for decades.
Sure.
And she's actually very much able to show that the terrain, aka the extracellular matrix, is constantly in communication with every single cell in the body and can be changed at all times and can change the nature and expression of the cancer cell at any moment.
Right. And then I think that's a good thing too, because it's not that somebody has cancer and you have to get rid of it. You have to cut it out and you have to fight against it, battle against it.
And we use that terminology, the war against cancer, the battle of a lifetime, and all the the F cancer modality, all those big kind of mottos out there. First of all, you have to remember this is us. The cancering process, these cells are of us, for us, around us. They are our teachers. They are our built-in alarm systems. And if we keep attacking it and killing it and suppressing it, we are, in essence, attacking, killing, and suppressing ourselves. And the other cells go along for the ride. Our healthy cells get sort of indiscriminately thrown into the mix when we go after it with the kill, paradigm. Right.
Yeah. And you mentioned the cancer cells being teachers. What do you mean by that?
Well, because when they get, it's when you have a cellular change. Okay, that's kind of like really simplifying this because cancer is what do they say? It's a combination of about 120 different diseases and all of these things happening simultaneously. And it's not even that the cancer cells are the problem; it's that they don't know how to die. Our healthy cells know how to die. They go through these life cycles, and they kind of do their job and move on. It's like you break it down and your body excretes it. Cancer cells don't have that signaling. They don't know when enough is enough. So over time, they become even more aggressive and even more unstable as they kind of oxidize in different ways, and their chemistry changes again and again. And what's interesting about them being our teacher is that it's that very process that tells us to pay attention, that tells us to say, well, how can I maybe contain their the riot a little bit better? How can I communicate to them that they're safe, that they are of me, and that we can help either keep them contained or we can help induce the death process in those cells again, so that we can then build and create new cells that differentiate into a new liver cell or a new skin cell versus a new cancer cell. And so they are, I tell people there's a couple examples of that, like herpes virus. When people are like, I got another herpes outbreak on my lip, they act like it's some outside external attack on them personally, and yet it is always about not enough good sleep, not enough water, not enough good eating, maybe too much sugar, too much stress. Stress is the biggie. So it's the same thing. It's an outward manifestation of a lifestyle choice. Hippocrates, the father of medicine, I love his his quote about the cure for the common cold is the common cold, because it forces us to stop. It forces us to rest, to hydrate, to nurture and nourish ourselves, to hunker down, under the covers and let people take care of us, with of course, the chicken soups and whatnot.
Right.
Well, cancer is very much, it's just not doing it in the form of a cold. It's using a sledgehammer versus a feather.
Right.
To alert us to that. Because the thing that I will note, and you've probably seen this a million times over, and I'm sure the patients of yours listening in on this today will own up to this, but there were ample opportunities to hear the signals, to see the red flags. I'm always intrigued by the patients who say to me, I was very healthy until I had cancer. And I will tell you this, from someone who looks under the hood in a very profound way with the way I test my patients with the blood tests and whatnot, that is absolutely not true. It's impossible. If the terrain is well, cancer doesn't get the upper hand. And so folks might have been ignoring or suppressing or medicating on some level some of the symptomology or psychology that was brewing before they had the shock of their diagnosis.
Right.
That it was not in a healthy system.
Yeah, right, exactly. Yeah.
And so he kept saying, hey, come on, guys, pay attention. And cancer is the ultimate wake-up call. It is.
Yeah.
And many people will say it's the best thing that ever happened to them, as awful at the same time as it can be. And what they will always say, they use the word teacher. It was an incredible teacher or an incredible opportunity. And so that's quite impressive to me. Yeah. And for my own life, that was definitely the case.
Yeah. And I'm sure the people that interpret it in that way leads to better results for them.
Absolutely. I mean, that's where some of the groundbreaking work in what I think in the 80s with Dr. Bertie Siegel's work on group dynamics, support groups and whatnot. What people were processing in those support groups was not their cancer cell or their cancer diagnosis or their tumor markers. They were processing their life experiences of what does this diagnosis mean for them, and what he was able to show in those support group environments, these people outlived folks that didn't participate in these groups and expressed a higher quality of life because of it. So when we can absolutely show that kind of, tapping into all of the possibilities that this diagnosis may give to somebody, there in and of itself is the healing.
Right. Yeah. And I know, there's probably a list of 100 things that people could be doing to build up their terrain, their internal terrain, so it's healthy. But, what are some of the most important things that people can do to be building up that healthy extracellular matrix and that healthy terrain in their body that you find?
Excellent. Well, I always tell people, for years, even before I started focusing on oncology, if my patients got adequate sleep during the windows of time that match the circadian rhythm of our planet, both, the outside of us as well as the inside, if they had adequate amounts of fresh air and sunshine, if they had access to clean drinking water, clean air, and had access to good, real, whole quality food, as well as a good communication, set of communication skills, and were living their purpose in life, of like, what do I want to be when I grow up, and truly how do I want to contribute to this planet, and we're in right relationship with the people that they surround themselves with, and thoughtfully interacted with others and really treated them the way they wanted to be treated, I would have no job. It would just be that simple. And I know it sounds very simplistic to many folks who feel like it should be this complex process. But what I witness in my practice and what I witness at the retreats that I offer to my patients is in just a few days, 3 to 4 day weekend, that's what we're doing, is focusing on those determinants of health, those basic needs being met. Miracles happen. Miracles. And there can be, like you said, hundreds. I offer thousands of opportunities and ways to change the terrain. But if you have the most perfect, supplement routine or chemotherapy routine, and you do not honor any of those other basic determinants of health, then you have no foundation to even put those medicines into to work.
Right. Right.
So I can have people say, well, I see the best of the head of MD Anderson in this field, and they're giving me the best, most up-to-date trial for this particular cancering process, and why am I not recovering? Well, because have you looked at, your relationship to yourself, to others? Have you looked at what you feel about your job? Have you looked at how you nourish your body? Do you put as much thought into what you ingest as much thought into maybe what you choose to put on in your body in the morning as far as clothing goes? So many people are walking through life on autopilot, or disconnected. Add the pharmaceutical combination to that can enhance that further, antidepressants and whatnot that can numb you to the life experience. And those cells that you are so actively wanting to destroy, they build momentum on that type of information that So I've worked with a lot of amazing oncologists and integrative oncologists and naturopathic oncologists, and I've seen them do amazing, innovative treatments, but forgetting to address the whole person. Until that whole being is addressed, I don't see amazing results. I just don't.
Yeah, so even if people are trying these alternative treatments or doing things on the internet or...
Or even going full bore every single possible conventional blast to the system. To me, what's more of the miracle is that people can go through so much, with lack of a better word, and a little cliche, but slash and burn kind of approach, between surgeries, chemo, and radiation. The people who survived that, they think that it was all about the treatment, that they're still here, but honestly, it goes so beyond that. It's the magic.
Right.
I've talked about this one-on-one in the past, but there's so much we don't know, and I'm more in awe of what I don't know than what I do know.
That's a great point. It's incredible too, that the body can take so much punishment from that chemo and from all that stuff and still
live. It's pretty incredible, and especially given how sort of sick our planet is. Basically, since World War II, we've added layer upon layer upon layer of toxicity to our food, our water, our air, our thoughts, our electrical or EMFs. All the things we're being exposed to on such a regular basis. It's more of a miracle to me that not all of us don't have cancer, or I should say, don't express cancer.
Sure.
Because I believe we all have cancer.
Right.
Plenty of studies show that we all have that potential. We all have those cells. Right. They're just contained because of good communication within our system. However, sometimes the straw that breaks the camel's back sends that into a whirling dervish effect throughout the whole body. But ultimately, it's more of a miracle to me that we're all kind of keep on keeping on despite ourselves.
Just amazing. Just how resilient the body is and how resilient we are to all these different external factors that are constantly beating us down from all angles.
Exactly. And that's what I think is so amazing with the work that I get to do is I have a moment to come in and sort of sweep up some of the debris and educate and empower my patients to understand they have a lot more control and responsibility to themselves and to this process than they've ever been sort of taught to believe. It really is a perspective thing. And the words, at the end, like I just completed an amazing retreat in North Carolina, and I'm still kind of riding that wave, but the words that come out of every single one of these retreats that we do is someone says they feel hope. And hope is amazing medicine. We really underestimate the power of hope. And I remember, most of us in medical school, conventional or non-conventional, we're all taught, don't give false hope. And I thought, that's so weird because really there's no such thing as false hope. Okay? I've watched people literally on their deathbed who were referred to me by hospice to offer supportive end-of-life care turn around. it doesn't happen often, but it happens often enough that you go, whoa, wait a minute. No one can put the expiration date on you. You know, you have a whole nother contract being worked out that's not apparent to anybody else around you. And it's awesome to see that. And that's what gets me out of bed every morning, even in the hard days when I do lose patients. Because everybody, I mean, first of all, everyone is going to die. Okay, that's a given. None of us are getting out of here alive.
Right.
Okay. And it's such a taboo discussion for whatever reason. Our culture is very uncomfortable for the dying process, that we're so afraid of dying that we forget to live. And I'm very inspired by the work of Stephen Jenkinson, the movie, his DVD Grief Walker, which is available for a free download. I'm really hoping to be able to do his 2-year training program. But basically, I feel if more people were willing to look at the death and dying process, they would live their lives much more richly and listen to their cellular communication much more richly and offer different information to their cells. Sounds kind of woo-woo and esoteric, but I'm telling you, working in this field for as long as I've worked it, when those pieces are being supported on that kind of psycho-spiritual level, that's when we can make the biggest impact on the physiology, on the nutrition, and the way that the nutrition gets absorbed into each of the cells. I mean, many of us can be eating the most perfect diet, but we have a leaky gut, so it's like pouring through like a sieve, or it's not getting into the cell. It's not able to cross the phospholipid bilayers and whatnot, and that happens a lot. People come with suitcases of supplements and probably thousands of dollars a month's worth of supplements, thinking, oh, I'm taking everything. You know, I should be well, but you might as well just pour it right into the toilet.
Right.
Like it's getting nowhere.
Right.
Yeah. So, yeah.
And, you know, would you agree that even, you know, you could be eating the most greatest diet and taking supplements, but would you agree that sometimes even like the emotional and the spiritual aspect is even more important than the physical?
Absolutely. Have you read Lawrence LeShan's book, Cancer as a Turning Point?
I haven't read it. I think I've heard of it.
It's one of my kind of required reading lists for my patients, because I really want them to find different tools to support themselves. And first of all, it's an amazing book that really underscores the importance of addressing the emotional component of our health and well-being. And Dr. LeShan's work basically showed that everybody who's had a cancer diagnosis, anywhere from 6 months to 2 years prior to that diagnosis, experienced some significant trauma. That could have been emotional trauma, physical trauma. I've had patients who've had back surgeries, and within a few months they've got cancer, or a whole bunch of dental work, you know, mercury removal or root canals, and suddenly they're cancering, or the death of a loved one. That's a big one. I tell you, death, loss triggers quite a cascade of events in our chemistry. Divorce, injury, loss of a job, or a loss of purpose. Those are very common predisposing factors that seem to really weaken the system in a way. And what my patients will tell you on the weekends when they come do the retreats is, yeah, we're talking about diet and lifestyle and certain nutrients and teaching them about their labs and how to approach this, but the real work is, it kind of catches them off guard. I might be creating for folks who might be doing retreats with me in the future, they will be working the emotional piece pretty significantly over the weekend. By the end of it, there's not a single dry eye at times, and sometimes those dry eye or those wet eyes are from deep laughter, belly laughter. Of the joy that we're all sharing with one another as well.
Right.
But folks are really letting themselves be vulnerable to getting to the root of their emotional, imbalances, their traumas, their betrayals. And man almighty, you see that shift, and you see the body absorb nutrition in a very, very different way.
Right.
So, yeah. I love that you brought that up, because I feel like if you don't address that piece, can you kind of patch things up? Yeah, sure. I've seen people do great work with kind of getting their leaky gut better and approaching it from a very physiological, biochemical place.
Sure.
But as far as helping kind of prevent a recurrence or a progression, I personally find that working that emotional piece is very, very critical to their getting through this.
Right.
Yeah.
And so you mentioned the book, which I'll post with this as well, but, for what would you recommend to people do, to be focusing on their purpose in life and their relationships and kind of dealing with some of these emotional issues and the loss and the grief and things like that? What would you recommend to somebody out there who's going through the cancering process?
Love it. That's a great question. Everyone's comfort level of how they want to approach this is going to be different. Some people want to dive right in. Other people may be very timid. Financial issues may be holding back some people from doing what they need to do. So there are plenty of studies out there that literally show that merely volunteering your time somewhere is one of the most profound ways to impact your cytokine expression, your immunoglobulin expression, definitely a release of endorphins for feel-good neurochemicals, stress hormone mitigators. I mean, there's so many pieces. So if people have no money, no resources, nothing along there, even volunteering 1 hour a week, maybe in a homeless shelter, maybe walking dogs down at your local humane society, maybe volunteering at teaching reading to folks as maybe English as their second language, or so many things. Maybe picking weeds out of your local organic farmer's garden. It doesn't matter how much service or the time frame, because even the tiniest amount can shift things. When you are helping somebody else, you are ultimately helping yourself. And when folks can have that moment, and you can be at your sickest to still offer that little bit of support. Maybe you're a resource for someone who's just gotten diagnosed. If you're willing to say from your local cancer group, if someone wants to talk, have them call me. Maybe that's your volunteer work. So that is step one that's free and accessible to all of us. And that's huge. Number two, there's a lot of great support groups out there. Number three, there's people like Brene Brown's work in tapping into intimacy and vulnerability. She's got a lot of great YouTubes and books out there, and people could read some of her work.
Right.
She's got a whole program starting, like diving deeper into the self. And then the other thing, like life coaches, and I know that that's part of what you do. If you've got the funds and you've got that ability, life coaches are amazing because you guys are trained to help people ask the right questions of themselves. Because oftentimes, I believe we all carry the answers and the information within us.
Right.
Not really unearth the questions to ask ourselves. Somebody like a therapist or a life coach can really just make you aware of things in a way that you've never been aware of before. The starting points. And Dr. LaShan's book is quite helpful. The whole back of his book is a workbook. And I literally spent 2 years working the back of that book.
Wow.
It gave me enough fodder
Yeah.
for 2 years of pretty profound, life-changing personal homework.
Right.
And you can find it, probably used online and from your local, independent health bookstore. We actually, in our office, on our blog, we did it as a Book of the Month club. We offer kind of an online book club to really hash out. We've done Dr. LaShan's book. We've done Lee Fortson's book on Embrace, Release, Heal. Getting ready to do T.S. Wiley's book, Lights Out, circadian rhythms, and how we connect to the environment and our environment affects us.
Right.
So we're always trying to create a dialogue of free resources for our patients to dig deeper if they don't have access to come to a retreat or to work with somebody like you.
Right.
Or
Right. Yeah, that's awesome. I've got a whole list of books that I'm going to be putting up with this. People have tons of stuff to read. This will be awesome.
Good. Excellent. Yeah.
But now, you mentioned miracles before, which is something I've been really interested in recently, too. I feel like it's a miracle that we're talking now. Like, you're in Colorado, I'm in Boston. That's crazy. This is a miracle.
On Skype.
You've never been on Skype before. She's wanted, for all the listeners, she's wanted to be on Skype for the past 3 years, and today is finally the day. But what are some of the most inspiring miracles that you've seen in people that have come across your path?
Well, there are so many that, literally every time we do a retreat, I go into such a deep, I literally become like a crying, walking bag of tears, but from deep joy. I'm not very good at poker face when it comes to sharing my emotion. It just wear it on my sleeve pretty readily. But I'll give an example of this last weekend. We had a gal who has a very catabolic process happening in stage 4 ovarian cancer, where her body's going cachexic, meaning her body's basically starving. And cachexia is a condition that takes the life of more than 70% of all patients with cancer. And yet our RD nutritionists and our oncologists are telling our patients just eat more calories. And they're telling them to eat more calories in things like angel food cake and pudding and ice cream. So things that are pretty much gasoline on the fire of cancer and cancering, that is known physiologically, biochemically, that the worst thing you put into a person with cachexia is sugar, carbohydrates, starches, and that the only way to turn it around is via more of a ketogenic. I know you've had a gentleman speak to that type of diet with a high amount of fat and a bit of protein to basically change that metabolic expression. And so we had this gal who came to our retreat who was in severe cachexia. Literally, probably, if from her labs and whatnot showing that she was an end-stage organ failure. I was actually quite shocked to see her at our retreat. But she lived about 30 minutes from where the retreat site was, so it wasn't a big travel for her. And she had been vegan for the past 34 years of her life. Now, I'll show you this. I'm not a vegan basher or a vegetarian basher. You're sitting here talking to a woman who was vegetarian for more than 20 years, vegan for about 7 of those years, and raw food vegan for a piece of that. And I really believed dogmatically that it was going to be what would cure me of my ailments. And I think it probably helped kind of clean some things up in my very toxic system in the beginning, but it was definitely by no means treating and healing my condition. And over time, I started getting sicker and sicker to the point where my life was threatened on several occasions, but my dogma of maintaining this diet and lifestyle was so important to me that I almost allowed that to take my life. So I can definitely have compassion for where this woman was coming from, but I'm watching her literally starving to death in front of us, and educating and expressing to her that restoring, so 5,000-year-old tradition in Ayurveda and 3,000-year-old tradition in Chinese medicine, the only ways you can convalesce and restore the body is things with animal protein, whether it's milk, and again, the type of milk, the quality, etc., from the ancient Ayurvedic texts showed that, good, raw, warm, spiced milk was kind of what everyone convalescing was given. So that debunks a lot of the vegan ideologies. And then in Chinese medicine, it was the organ broths, the tissues, the bone broths that were restoring people back to health. And then typically those diets were still more vegetarian-oriented, but they used those nutrient-dense foods to bring them back to balance. And so this woman, after learning that over the weekend, listening to everything we educated and watching, man, she was so sick. She had to lay down for most of the conference initially. By the end of the second day, she was up at the table, bright-eyed, bushy-tailed, skin color amazing. She put on 2 pounds in the weekend when she was losing an average of a pound every couple of days from the cachexic process. And by the end of the weekend, all we were giving her was she was willing to try a few eggs, which we got beautiful local eggs, and bone broths. So we made some really great soups over the weekend. Her brain was different. She was engaged, her presence, her ability to show up. And by the end of the weekend, she was, crying that she felt cellularly different. And she worked the process of letting go of an ideology that she truly believed in her heart of hearts was serving her. And within a weekend realized I was not listening deeply enough to my body as to what it really needed. I literally watched her heal in front of me. I've been home now for a week, almost to the, from that, and have gotten 2 email updates from her that she continues to gain weight and stabilize, and her chemistry is already changing for the labs, and her oncologist is over the moon with her response to therapy. So that's a subtle, miracle to me, because for their, ideology, she probably wouldn't have been here a month from now. And then the others, like the person who kind of pushed me into becoming more involved in retreats and whatnot, was a woman who came in to see us, who was in a wheelchair with an oxygen tank, with a mask on her face, and so severely cachexic and so much ascites that she was also seeking end-of-life care. And that was 4.5 years ago. And her doctors, makes me laugh hysterically, they always say, well, the Taxol must have finally kicked in, after being on that for surgery after surgery and radiation and ascites being drained over and over and chemo after chemo, nothing helping, and she was rapidly dying, and now is so alive and well. She herself is becoming a coach in all of this process, and has inspired an entire movement of women given death sentences with stage 4 ovarian cancer that are flooding our practice and have been for a couple of years now. And so that's the other extreme. Of someone who made a subtle dietary change over a weekend and is improving, and someone who changed everything. And what she will tell you is the biggest thing she changed was her relationship, with her husband, and other issues around finding her life purpose. That was her biggest healing. And she was on a very physical last leg of things. So, I give those 2 to kind of show 2 ends of the spectrum, but to show that the like you asked earlier, how important is the psychosocial piece? It's important. It's a key player. Yeah.
And so the woman did the work on the relationship and the life purpose in one of the retreats with you, or?
She actually, before I started doing retreats. Oh. So we worked together for a very long time, and she worked with a woman. I mean, she chose a lot of different modalities. She chose things like, different counseling and soul cards and treat like acupuncture to kind of work on the mental, emotional pieces of things. And definitely she was doing physical stuff like nutritional IVs and whatnot to build her physical body back up. She did an enormous amount of work on her emotional body during this time simultaneously. And I don't think she'd be the thriving woman she is today had she not been on that journey. And she continues. I mean, she just did some amazing work with fall equinox celebration out in a beautiful part of the southwest of the country, and basically did a vision quest, kind of a Native American-based healing ceremony, and it's life-changing for her. It's really life-changing.
Yeah, that's so cool. So awesome. And so now where can people find out more information about you? Because I know after hearing about the retreats myself, just when we're talking now, I'm like, oh, I want to go. Like, this sounds so awesome.
Well, we have my regular work website is namastehealthcenter.com, NAMASTE, Health Center, and namaste comes from the ancient Sanskrit word, the spirit in me acknowledges the spirit in you. So hopefully that gives you a sense that we come from a very holistic, thoughtful, deeply supported practice. I'm lucky enough to work with 2 more amazing Chinese medicine practitioners, an acupuncturist, another naturopathic doctor, a medical doctor, a couple of IV nurses, a massage therapist who also does constitutional hydrotherapy, an amazing master in nutritional therapy, nutritionist, 2 amazing women at the front desk. I actually tell them they're the most important players in our office. That's Sierra and Sid. Andrea is kind of our tech goddess. She's actually in India for a year retreat right now, doing so much of our blog work from far away. My husband's doing epigenetic counseling right now from data received from the 23andMe, kind of gene blueprint information on how to manipulate people's biochemical pathways and expressions. He's working in the office as well. I know I'm missing some people, but that should give you kind of a gist that we're a very comprehensive center. From that, also, if you can go on the regular website, you can click on the blog, which will redirect you, or you can go directly to intuitiveterrain.com. And that is the it place to go for cancer resources research. And people can spend hours. We have everything there, like book lists, recommended and TED Talks and videos. We have, because we want to educate and empower our patients. We talk about past and future retreats. As of November, so just this month, I closed my practice to new oncology patients for myself, but my colleagues are still taking new patients. 80% of my patients come from all over the world. And then what I am starting in February are retreats for practitioners, all kinds, who are interested in taking this message into their own lives, into their own practice. A lot of the doctors who are signed up so far were inspired to do so by their patients. I tell people that I don't change medicine, my patients change medicine. So the amazing thing is my patients are very empowered people who change the face of medicine every single day. And so when they can inspire in their physicians to see miracles within them, their doctors are like, what are you doing? Let's go learn more. So that's coming up, and there's more information on that. We also are doing retreats that are more immersion kind of retreats, like people who want to come and live a week in the life of an anti-cancer lifestyle. Mind, body, spirit, diet, nutrition, cooking classes, yoga, meditation, breathing, adventure, and life purposing, you name it, those are happening as well several times a year. So you don't necessarily have to be an established patient to enjoy one of those opportunities. This month in Cancer Strategies Journal, which is an amazing integrative oncology journal that's peer-reviewed, we have a huge article about our retreats, the format of them. I'd encourage people to subscribe to this amazing journal, because you will learn more about the field of integrative oncology than you will ever learn from the general media. But it's something that my goal is to inspire more practitioners like yourself, from life coaches and nutritionists and physical therapists, nutritionists, as well as conventional doctors, naturopaths, acupuncturists, chiropractors, anyone interested in working with the field of the cancering process. I want to get this information out there. We need help. We are so inundated with people needing and wanting this information. We can't accommodate them all. And so our next best option is to train you guys to do the same. So, like, what do you say? You can teach it, or you can, like, feed a man to fish or teach a man to fish.
Right.
So we're heading toward the teach a man to fish concept here, but it's awesome. It's talk about finding your life purpose. I already thought I had it good in my practice, but the last year of really diving full blown into this new model of care is the most rewarding and exciting thing I've ever had the pleasure and opportunity to do.
Yeah, that's so awesome, so inspiring, and so many great resources that we've talked about today. I'm going to post them all, and I'll definitely post on your blog, and it's so helpful for people to be going and researching on there. But this has been so great. I so appreciate the work that you do and everything I've learned from you so far, and just really very excited for the future. A very hopeful future for both of us, as well as all the people this interview is going to touch, and all the people that are going to come work with you. So.
Right. Well, and also, I'm just going to put a plug in for Joe, is that he is working towards his first retreat. He got me to be first on Skype. I'm going to help him to get his first retreat off the ground in June.
All right.
So it's going to happen, man. It's great.
Awesome.
Thank you. Thank you for the work you're doing.
All right. Well, thank you so much. And thank you, everybody, for listening. I will be posting all the resources along with this video. And hope to talk to you soon.
You will.